Hello, everyone. Thank you for attending today's discussion, State of Health 2021, Top Strategies to Improve Your Member Experience and Boost Engagement in the Wake of COVID-19. I'm Linda Hand, CEO of Prealize Health, and I'm very happy to have you with us today. I'll be moderating this webinar, but a few technical notes before we begin. The discussion is being recorded and will be available on demand within a few days of the event. We'll send you an email when it's available. We'll also follow the discussion with a Q&A session, so please submit your questions using the question and answers tab. Also, if you encounter any technical problems during the event, you can describe the problem in the question and answers tab. Our team is standing by to help. So, the panelists, who will introduce themselves in a moment, are joining us to discuss the findings from our recent 2021 State of Health report, which identified the key conditions payers and providers should proactively address in 2021 based on healthcare utilization in 2020, and particularly the significant healthcare utilization declines that occurred due to the COVID-19 pandemic. To identify those top conditions to watch, we analyzed claims data for more than 580,000 commercial, Medicare, and Medicaid patients between March and August of 2020. We then applied over 50 machine learning models built into our platform to project the diagnostic and utilization trends for 2021. So while the report's findings are meant to provide the healthcare industry with a look at some of the biggest trends to watch for 2021, this work is something that we do on an ongoing basis for plans every day, provider organizations as well. Forecasting based on their own patient populations, which makes the results highly accurate and actionable. Our machine learning models assess over 30 clinical drivers of future healthcare utilization to predict a patient's risk for being diagnosed with a clinical condition or needing a clinical procedure up to 18 months before a claim is filed. Based on 2020 care deferrals, our 2021 predictions include an 18% increase in patients diagnosed with ischemic heart disease and a 14% increase in patients diagnosed with congestive heart failure in 2021, a 23% increase in cancer diagnoses, and a 112% increase in patients diagnosed with fractures. So before we dive into the discussion, let's start with a round of introductions. I'll have each of the panelists start by sharing a bit about their backgrounds and current positions. Let's start with John Cake.
Hi, everyone. Good morning or afternoon. My name is John Cake. I'm the Director of Strategic Investments at Premera Blue Cross. For those of you that don't know Premera is the Blue Plan in Washington and Alaska, and we serve over 2.5 million members across the country. We work with some high-profile companies here that are headquartered in the Pacific Northwest. Some of those that you may know and experience on a daily basis, like Amazon, Microsoft, and Starbucks, to name a few. And primarily in my role, I work with our business leaders to identify and build partnerships with innovative companies to help us make healthcare work better for our members and our provider partners and our customers. Prior to my time at Premera, I worked for an investment banking company, advising healthcare companies on mergers and acquisitions and capital formation strategies. And prior to that was part of a corporate development team for a diversified healthcare company. All in, I've been working in the healthcare space, trying to make healthcare work better for about 25 years.
All right, let's go with Kristen.
Thank you, Linda, and hello, everyone. It is great to be here today. I'm honored to be a member of Prealize's advisory board and am an active advisor and investor in the healthcare services and healthcare technology spaces currently. I've spent most of my past many years as an operating executive in the healthcare services and technology spaces, largely at DaVita, as well as most recently at Castlight Health, building and growing exciting businesses with great teams.
All right, Ryan.
Hi, everyone. Thank you so much for joining us today. My name is Ryan Pinchot. I'm a technical advisor to the chairman at Kleiner Perkins, but was formerly the Deputy Chief Technology Officer for the country under the Obama administration. I've done a lot of healthcare work during that time, especially now, invest in a lot of disruptive healthcare companies. I'm fortunate to be on the board with Linda and team here at Prealize. During my time in DC, I worked and was part of the healthcare.gov rescue team. And so it's been a long time since then, but there's just a lot of lessons to be learned from that experience that I'll try to maybe sprinkle through here, but was also part of the Affordable Care Act implementation side. And so I can't wait to dig into some of those things, but it's great to be here. Thank you, Linda.
Great. So I'm being made aware that I think we kicked off and several attendees joined a little bit late. So I wanted to kind of rehash a few of the intro comments that I had there, just real high level. And obviously you can download the report, the State of Health 2021, that we created by analyzing over 580,000 commercial Medicare, Medicaid patients between March and August of 2020. We use the Prealize platform in all of our models to really specifically analyze the particular population. So the results are very specific to that region and that membership, if you will. But based on 2020 care deferrals, the 2021 predictions that we released in the report include an 18% increase in patients diagnosed with ischemic heart disease, 14% increase in patients diagnosed with congestive heart failure, a 23% increase in cancer diagnoses, and 112% increase in patients diagnosed with fractures. And again, you can read the full report, download it from our website. So let's dive into the discussion. We are going to discuss those particular healthcare utilization predictions and how healthcare leaders should respond to those predictions in a moment. But let's take a minute to look back on 2020. Many members experienced unprecedented challenges last year, from increased stress and anxiety due to pandemic to job loss, and for some loss of loved ones to COVID-19. And those consequences did not hit us all equally, right? COVID further exposed inequities in access to healthcare system and society at large. So panelists, how should these factors influence how health plans approach member experience and member engagement this year?
Well, Linda, maybe I'll jump in and start from the payer perspective. You know, we certainly saw 2020 was a one-of-a-kind year from a utilization perspective, with early in the year, you know, most of the providers shutting down for the reasons because of the pandemic, and then over the course of the year, starting to see returns to more normalized utilization as both providers made shifts to how their business model was working, and I think as people became more comfortable with how to access care in and during the pandemic. But at the end of the day, I think there were a couple of key things that we saw that were going to have lasting effects that we're going to have to think about working with our members to make sure they get back on track. And first and foremost is just all of the missed care or delayed treatment, both for those members that are dealing with existing conditions, but also from a preventative perspective that just kind of were put to the side for obvious reasons. And so there's going to be a little bit of catch up to some extent. And so that's an area where we're focusing in. I think you mentioned in your question the impact around behavioral health, and we see behavioral health as really a compounding factor for folks with their existing conditions, in addition to just being things that we need to look out on their own and so we're being aware of how to weave that to some of the messaging and making that aware making our members aware of opportunities there to take advantage of that. And then I think secondarily, or just the third part is really the unknown of what is COVID going to do from a clinical perspective into the future. Are there going to be lasting impacts of folks that have had COVID that could compound healthcare needs? And so I think it's still, we're in the middle of it. It's a little bit too early to call. Hopefully we can get to a state of being more normal here, but it's important for us health plans, even though we get a bad rap, we want our members to access care and take care of themselves as much as possible, because at the end of the day, that's what's best for them, and ultimately getting people healthy and keeping people healthy is the most important thing. And so from a member experience perspective, knowing where our members are in their own healthcare journeys and being able to get ahead and know what potentially some of the future needs that are going to be in the upcoming year can allow us to target programs for those people, make sure that we have things in place for the types of clinical conditions that we know are going to be relevant there, and will allow us to kind of adapt and meet our members where they are.
Linda, I'm part of a project called COVID Act Now, which I'll maybe share the link in the chat. But what we do is we help people understand how COVID is spreading in their communities. We help people understand where they can find vaccination sites, where people can find more resources. I mean, I think right now people need navigation. And so, you know, that experience over there, I think can be translated here. I think, you know, this site, COVID Act Now, started out as a volunteer project that started to get millions of people coming to it because they didn't know where else to go. And I think the same is going to happen here this year in 2021, right? So rather than blindly re-entering the health system in 2021, I think it's an opportunity for you to be there for your members. Help them interact with the healthcare system on your terms, right? Help them truly navigate it in the way that you want them to. And really figure out a way to have an engagement strategy that touches everybody, but's really targeted as well too at the same time. Because there are a set of members that you have that need care more immediately, and being really thoughtful about that, being able to reach everyone, but also spend the resources you have in a pretty thoughtful and strategic way. I think the other thing to kind of maybe take away from at least what we're seeing on the COVID side of COVID Act Now that does apply here is that there is going to be a huge supply versus demand mismatch, right? Right now for its, you know, where can I get vaccinated? Where do I go? There's so much hunger for people to get this vaccine so they can return to normal. There's going to be that equivalent feeling for a lot of things that people are, you know, usually normally staggered their experience with the health system. And so try to get ahead of where you believe and see those supply demand mismatches are going to be. It might take reaching out to some of your providers and, you know, an opportunity for you to be a good partner with them, right? To figure out what they're seeing as well. But there's a lot that can happen this year. And, you know, just like John kind of shared, you know, from a health plan point of view, you are the one entity that really is there for a person from the start to the end, right, of this year. And so kind of take that responsibility and really kind of live up, because I think right now it's this like great moment that 2021 can end in a very great place. And so I think a lot of us are just optimistic. And so be there, help people navigate the healthcare system and do it in your special way.
That is inspiring, Ryan. I feel like that's like more closing comments. You're starting off with inspiration. That's going to be hard to follow. But what I would say here is that I think these inequities, which we've all intellectually known are there and contribute to all of this, have been highlighted, as you mentioned, Linda. And from my perspective, it calls all that much more for the need of advanced technologies to help plans and providers reach out to people and meet them where they are. Because just acknowledging that things like education, demographics, ethnicity, gender, work status, just acknowledging that all of those things impact health outcomes and the availability and access to care doesn't change our ingrained healthcare behaviors. And with all due respect to our human capabilities, it's hard for us to take all of those variables in, understand where people can be reached, how to message them about whether it is finding your vaccine or reminding you of a preventive care screening that can be done virtually. And so leveraging, I think, technology that can help you understand and segment the population in a smart and approachable way is all that much more called for now if it wasn't before.
I think those are great points, and just along the health equity side and some of the things that I think we knew were out there and made even more and more apparent after 2021. I know health plans across the country are doubling down and being super committed in terms of taking a more systematic approach to looking to solve some of these things. And I think member engagement is at the forefront of those, and being able to communicate effectively with all different types of folks in different places in their healthcare journeys. And so I would echo that. I know we're looking at a number of different ways to do that, in addition to getting started right away by working with community organizations and things that are already there on the ground to support the efforts that they're doing here in the short term. So,
yeah, really important work. Thank you. So let's look to the year ahead. I think there's significant challenges that health plans will face, as noted in our report. One of the biggest challenges will be the conditions that are diagnosed at later stages due to 2020 utilization decline. And with the ongoing pandemic, many patients are continuing to delay health visits and preventative care this year. So, how can member engagement and experienced leaders help address that challenge?
It's a great question. I feel like you are competing with people's limited time this year, right? I mean, you've got families that have had the hardest time ever with moms and dads working triple time, both as breadwinners, but caretakers and educators. I guarantee that, half of you on this call probably have a young kid in the room next door taking a class, right? And so both time is a really hard resource to come by, but also money too, right? There's almost this responsibility for us to figure out a way to give our members alternatives and choices, and not just alternatives making things more convenient on the time side, but really being thoughtful and thinking about the cost side of it as well too. And so I think, Linda, my reaction there would be is just try to find as many ways as possible to give your members choices. And you might have to get really creative about those. And really, I think every plan, depending on where you are in the country and who you serve, there are going to be different kinds of alternatives. And so, maybe it's the kind of call to be creative on this one, but really think about it as people have limited time and people have limited money. And so if we really need to get people to come in, how can we really incentivize kind of the actions we want to see?
Mm-hmm.
Yeah, I would, I echo. I mean, it's just so understandable that during this time, we've all just had to ruthlessly prioritize. And unfortunately, we tend to take care of our healthcare when we absolutely have to. And so under these circumstances, it's been even more so. And so we are, dealing with what I think is going to be daunting when it does happen, but this delay of care going to have significant impact. And so I think it is a combination of accessibility, virtual or in person. I think the affordability piece is key. And so the country and plans have made strides in how to make things accessible and affordable. For instance, I learned through reading about some of this delay in care that for patients needing colorectal cancer screening, they might not know that there is a home screening kit called Cologuard. Now, I unfortunately don't know a ton about that screening kit, but I was, glad to hear that there is a home-based colorectal screening kit that people can do at home. And so kind of making sure that information about these screenings, for instance, that we tend to think have to be in person, what can we do virtually or remotely? I think there's also, just thinking of my own experience, by the 6th time that I was speaking to my wonderful receptionist at my dental office, delaying and postponing a much needed dental cleaning, I think she realized that she could give me some comfort in their protocols and what it would be like to come in for a dental screening. And once I understood that it was, more than just checking my temperature and everything else business as usual, but she explained to me how many people were in the office at one time, how frequently is the staff and dentist being tested, what are their protocols on cleaning, and what type of air filtration have they put in. Just all of those things lessened my anxiety because, fortunately, I wasn't sitting there with a sore tooth, but I had a long overdue dental exam, and I was anxious about going in. And so I think there's also just finding ways to meet people where they are. And in addition to making things available virtually, making things accessible, I think also just how can we help people understand what it might be like, and that may help people get this preventive care as well.
I think those are great points, and I know from the Premera side, we really think about, especially in confusing times where COVID, the fog of everything that's going on and was going on in 2020, and I think still continuing a little bit more in 2021, the healthcare system accessing the system is still confusing on its best days. And so for us, it's really about focusing in on how can we help members understand their benefits. All of those things it's a nice tailwind to where it gives you confidence then to ask those questions, to get your preventative care, to re-engage with the healthcare system in the right way. And so making sure that our members and showing up, answering questions for them, being proactive about, encouraging them to get value for the premiums they've already paid are important. And so I think the second piece to that is really about how to access care. In 2020, I know we spun up as a result of the demand, a number of new access points for our members, whether it be virtual care, at-home services, and things like that. Like Kristen mentioned, you can now get things delivered to you in the mail and things like that we've been talking about for a long time, but never had the real reason to implement in any meaningful way. And so, to the extent that COVID was a catalyst for bringing some of these things online, that is a net positive in a very difficult year. But I think too, the other aspect is our provider partners too made significant changes in how they were delivering care as well, which added to, I think, some of the need for payers to show up, because we are, as Ryan said earlier, the kind of the thread of continuity in how members access the healthcare system. And so by doing a good job helping them explore choices for care, both plan sponsored and provider sponsored, and ultimately kind of creating a link back to those, a home base, if you will, where they have confidence. We see that as the real opportunity in and around supporting our members. And of course, one of the big challenges with that, it alludes to the need of having innovative partners like Prealize. Some of those experiences can be, garbage in, garbage out. I know as an industry, healthcare is trying really hard to catch up and be more modern and comparable to other experiences we see in other industries. And so as we seek to leverage those kind of technologies and partner with companies like Prealize that can give us better information that allows us to be more timely and relevant and on point for our members when they need us, that's the real opportunity that we have here in front of us, and hopefully we can start to seize on in a real way.
Yeah, really good points. So in the report, we share these predictions for top conditions most at risk of increased diagnoses in 2021 based on our predictive models. And as I mentioned earlier in the beginning, the top 3 conditions are cancer, cardiac conditions, and fractures. So what do you all think some of the top actions you would recommend for healthcare leaders to proactively address these concerns?
Yeah, I think, Linda, in addition to identifying the concerns, I think it gets here to then identifying, well, which of my members, which of my patients are at particular risk for this? And then kind of along this theme here of then, how do I meet them where they are? It's a little bit to the point of, saying, it's like the old saying, flyers that say it's Heart Health Month kind of just fly by and don't mean anything to me. But if you can kind of message me in a manner that says, hey, did you know that you are in, this age category, and it is more important than ever to get this screening, it starts to be just a little bit more relevant because you've told me something that I now need to remember or care about. And with the help of technology, we can be even more personalized than that and still do it. I think sometimes in healthcare, when we talk about personalized outreach, people say, and by people, just from my experience, I've talked to a lot of plans and providers, they say, but I think my patients and members are going to, I think I'm Big Brother if I can message them in a quote unquote personalized way. And I think sometimes here we don't give our members and patients kind of the benefit of the doubt, so to speak, and we kind of patronize a little bit because in all other aspects of how we interact with, our insurance provider, our grocery purchases, anything that we do online. We are receiving personalized and tailored information back. And so there absolutely is a way to have tailored information to your patients and population and members in a manner that is, one, of course, as always, in compliance with all rules and regulations that involve healthcare by far, but also in a consumer-friendly manner that actually does message to an individual what they can do versus some kind of general public service announcement type. I think the other thing that I've seen is an increasing direct to consumer, if you will, outreach and direct to consumer availability of things like breast cancer screening. And so I think coupled with the availability of technology, the awareness of plans and providers to engage patients, but frankly, consumers are increasingly aware and increasingly have a willingness in some cases and an access to consumer-oriented ways to do their own screening and tests and kind of take more charge of their own care. And so that's, I think, another way in which we can think that cancer and cardiac and fractures and being safe to avoid fractures can take place.
Super.
I was going to jump in and say, one of the things in the challenges that I experience in working at a payer is that we don't deliver care, and we're trying to be, to some extent historically, I like to talk about being there with our member right up until the point they go in and sit on the table, and we're right there when they come out, and that's a perfect ideal state and kind of aspirational, but to some extent, I think in that context, it really is about helping them understand and access the highest quality care. For us, that starts with things like, surfacing options, understanding benefits, helping seek out the right providers, providing information, like I said, to inform those decisions. Payers too, also, we've huge initiatives to try to improve the value that our members get by aligning incentives in how care is delivering, from how we pay for care and how we contract with members. And so moving towards quality, more quality-based measures, value-based contracts and things like that. And so, by doing that, that sort of creates an alignment all the way up and down the system. And we've found that being a payer and being in the unique situation of where we have perhaps more data than anybody around sort of the longitudinal path of a member's care at all of the different access points through reimbursing for all of those things along the way, it puts us in a unique position to potentially explore ways to share information with both members and providers to help inform the way care is being delivered, both from an access point, but also downstream referrals, things like that really play into some of those incentives to make sure that outcomes are being maximized as much as possible. And so for us, we see that as a kind of a win for everybody. Patients are healthy, have great experiences, are getting value for what they pay for. Providers know as much as we do about the members when they walk in. They don't have blind spots in data because they don't have the specialist that they went to, or the lab reports that we get, lab values or prescription information that we get. Being able to kind of share that at real time is a hopefully a great benefit. And then ultimately, because we're getting better outcomes and driving a better experience, we're creating value and saving money for everybody, taking some costs out of the system for some of those inefficiencies. So I think for us, working with a company like Prealize with some of the modern technology that you guys bring to the table has been great, because it creates within the context of that system that I just described, it creates turns our data into something that's really actionable for everybody on the payer, especially on the provider side, where we could say, hey, here's the member that's likely dealing with these kind of things, or we're under a value-based contract, and so here's a handful of folks that we have good reason to believe they're going to be higher utilizers in the upcoming year, or have some specific conditions that we'd love for you to follow up on. And we see that as hopefully additive to the provider's work, and a way to support the hard work that they're doing in trying to make and keep our patients as healthy as possible.
Yep.
Linda, I'm reacting to the findings that you shared from the beginning, right? It's really from the real life claims data across the entire system. You've got oncology, cardiology, and ortho. If that's where demand is going to pop, I mean, I feel like you've given this group a head start, right? It's like, how can you go and maybe talk to those providers, right? To those care teams that are already trying to get back to this new normal, and really reach out to them to find out what they're experiencing, right? And what they're seeing on the ground, and really seeing how your member interaction with them could be made better. Like, I think the engineer in me is kind of thinking how can I get ahead of the problem as well as troubleshoot at the same time? And part of it is like, how do I spend time with those categories of providers to see what they're seeing, get ahead of it, and really make that experience as smooth as possible. I mean, those three areas also are really taxing. It's not just one person you're going to. There's lots of rehab, there's lots of follow-up. So there's a lot there that I think getting ahead of it can actually really help. And then thinking about it from so the data that you shared, of course, is across multiple, our entire, the Prealize's claims data. But what your system can do, I mean, really, it can target things to your population in particular. And maybe the better way to say that is that, you can do these things that are thoughtful and targeted, not based on what everybody else is seeing, but really what's happening within your health plan. And I think that's one of the powers of the Prealize team and the AI/ML technology that they have, is saying, well, hey, that's what you're saying for the broader population, but tell me about my members. Tell me about how I can be thoughtful and targeted with them. So it's it offers a lot of promise. So it's sure, those may be the three top areas that are going to pop for everyone, but really for me and my population and the members that I have to take care of, it likely might be slightly different. So
yeah, Ryan, sorry, Linda. I was just going to say, we've had some great work early on with Prealize in doing just that with at an employer group level as well. And so, one of the pain points that we've had for as long as I can remember is, especially with our self-funded clients, we produce a report that shows, hey, here's what happened in your population over the last year. And the response was always, well, this is really interesting. Can you tell me what's going to happen next year so I can get out in front of it, just like you were saying? And so doing some of the work with Prealize and their models, and being able to even, like you said, kind of filter down to sub-levels of populations to some extent, starts to be able to give us the opportunity to answer those questions and allow those groups and our leaders in our insured populations the ability to kind of say, hey, we might see a swell of these kind of things coming forward. What can we be doing to get ahead of it, versus being much more reactive to some data that, quite frankly, may be up to a year or more old and water under the bridge. So it's an interesting paradigm shift for us as a payer and how we've traditionally done things. But it creates a world of opportunity in terms of starting to close the gap and some of the pain points for our employer customers.
Yeah, that brings.
Brian, you made it. Go ahead.
Sorry, Linda, to interrupt you again. Just what you were saying, John, reminds me of something that we saw at Castlight with our employer population as well, which is at a high level, oftentimes we would hear benefit leaders say, I need to address musculoskeletal issues. I need to address chronic disease, especially diabetes. And I need to address prenatal and kind of pregnancy related claims. And at a high level, this is what someone would say, kind of, this is where my cost experience has been over the last couple of years. But we were able to remind them and show through data, then just what you can do even so much more now at Prealize is there's a long tail of very meaningful other interventions and conditions that you can address. For instance, in this case, there was a population where asthma and behavioral health, in particular eating disorders, were something that needed to be addressed, but they didn't kind of appear in that like top of the funnel looking at major cost. But there were things that the plan, and in that case, the employer, could address in a very cost-efficient way for those populations, in a way that made both the outcomes for those populations much better, productivity increased, health outcome increased, and at a cost that was, kind of, it was a good ROI for the employer to implement solutions on those two areas as well, even though, again, they didn't show up from a volume perspective as pervasively in the population. So maybe that's just kind of echoing and giving another example of what John said, this ability gives you to address specific populations.
Mm-hmm. Yeah, I think the ability to orchestrate proactively those that need to get back into the health system more urgently, again, with understanding the conditions that are going to pop, as Ryan said. But I loved your perspective, Ryan, on we have to think about the ecosystem that it takes for those particular conditions and the coordination across that, which then brings me I want to double back a little bit on John Cake's comment around data sharing, right? We've got a mandate around interoperability. It seems to me that data and technology could offer an infrastructure or a framework or a landscape for a better consumer experience as well. So maybe John, Ryan, you could talk about, from a regulatory perspective, your thoughts from that perspective, and then John, you could comment a bit on what Premera has done, and Kristen, what you're seeing in terms of other technology to influence the consumer experience with data sharing.
Of course, I think there's one, because this is I think we mostly have health plans on the call. I think the secret of interoperability is that from our world of health plans and health claims, we've actually been exchanging data for a very long time, right? We're actually really, really good at it. I think the parts that we're trying to be addressed from the regulatory side was, well, on the clinical side, how can data be exchanged between providers and their EHR systems and so forth? And so, this is me, one part saying that from a plan point of view, we're used to moving data around. From the EHR point of view, the past decade has been this shift of, well, helping clinicians adopt systems really through the High Tech Act and all those dollars. And then once doing that, equipping those systems with the right way to structure data, and then now being able to move it in ways that are actually useful through, I'm sure you all have heard of, an API standard called FHIR, right? Like the world of clinical data has made the biggest leaps in the past 10 years, right? Really putting more structure to it, putting more ability to move it, and then really empowering consumers with that as well too. I think a hidden hero in a lot of this, is actually Apple and their Health Kit product, really jumping on a standard that was done by industry, FHIR, a standard that the government really kind of encouraged, right? Industry, you come up with the standard, we'll back it. And Apple coming in saying, well, hey, if we're going to have a Health Kit integration thing, let's use that. And they really acted as this sort of quality check for the entire EHR system, right? I mean, you have every hospital CEO with an iPhone saying, well, how come my hospital system isn't on this phone yet? And it really forced a lot of the guts of how the technical stuff works to get right. And so we're kind of in this really neat moment where clinical data has never been as structured in this way before. This data can be and is being shared with with claims in appropriate ways. And so I don't know, like Linda, I think my reaction to it is actually we're kind of in this exciting time. I think the things and challenges we do face is a lot of people that are trying to help consumers, I think, are seeing an issue that we've seen on the plan side this whole time is, well, it's really hard to match members across different sources of data and things like that. And so while consumers are facing that, we're already like, hey, we could have told you that a little bit. That's why we have certain IDs and things like that. And so I really think the next, let's call it 4 years, has to really be around creating better linkages of the different data that does get created that on behalf of me, and really finding ways for it to get put to really good use. Like that's the key, right? I mean, we can structure all this stuff. There's that RAND report that said that, we're going to save billions and billions. I think it was like $40 billion by electrifying health records. And the missing link, though, is we haven't been able to get as much out of them as we expected, because it's actually really hard to link a lot of this data together and then to confidently act on it. And so I think I'm really proud of you and the team at Prealize, is at least behind the scenes for health plans, we're able to link these things. We're able to do things in ways that are thoughtful, and you can intervene in a way that's different than how a clinician would have to intervene, right? The stakes are slightly different. And so I'm excited to see how the next 4 years plays out, but I think you're going to hear at least me be a really big advocate, of course, of more structure, more sharing, but really figuring out how the health system knows it's really me, Ryan, that's behind this piece of data. And so that's my kind of reaction.
Yeah. John, I know Premera's done some interesting stuff.
Yeah, I just, yes to everything Ryan said. I mean, I think just in my career, there were points in time where the technology just wasn't there to do those kind of things, to think about, integrating into an Epic system or something. That was just this massive, can't be done thing. And then it shifted to being maybe it's a 2-year thing, maybe it's a 1-year thing. And so that those barriers are coming crashing down with the way technology is changing. And so it presents a really great opportunity for us, as Ryan was saying, and also with the other non-traditional healthcare entities like Apple and Google and Amazon and everybody else that's kind of thinking about ways to exchange data. And so we are seeing the abilities to do that, and certainly the federal government, through some of the more recent mandates with payer and provider interoperability, is lighting a fire on a lot of our payers to invest if they're not already investing there. And fortunately, Premera, I think we're more. I think it's fair to say we've been a leader in some of trying to address this through internal innovation and partnerships with our local health systems in our area to get to a place where we can kind of create this unified set of information that is free flowing and timely and accurate. We've couple of shameless plugs here, but we've made an investment in a company that's kind of coming out of stealth mode called Project Connect, that's geared towards doing just that, helping payers and providers exchange that information and kind of create that, Ryan alluded to, the translation of different types of data using some of the standards and taking it even a step further to now start to find use cases with members and patients at the center, but ways to create efficiency in the exchange of information that ultimately makes things work better for everybody involved. We're also, those are big kind of system level things, but even down to just pushing data to the point of care. We're also working with a company called Vim that has a very elegant and easy browser-based extension, just like you would add to your Chrome extension like we do every day for different things. And now the ability to kind of, for us to push information about our member, and it knows there's a Premera member sitting there at the dock, and this is what their benefits are, this is their eligibility, these are some care gaps they potentially have, these are where high quality referrals would be downstream. And so those are types of things that ultimately support, I think, both hopefully to some extent doing it well and linking it into the workflow for providers to make it kind of seamless and hopefully helpful, and then ultimately for the member, it just turns out to be a great experience because they're not surprised by getting referred somewhere out of network, like we all have probably been at some point, and you get a big bill and go, why did this happen? Why did my doctor know they referred me to somebody who's not in network, or they prescribed a drug that wasn't part of my formulary, or if they had prescribed this, I could have paid $5 copay versus $50 copay, or what have you. And so those are some really practical examples of how we hope to see this stuff work. And then there's really even more aspirational things that I know a lot of companies are thinking about. I was talking about walking out of the office and getting a receipt and knowing what you owe and being able to pay that and settle it in almost real time, just like every other experience that we have from a consumer's perspective. So we're right on the forefront of those things, and it's super exciting. And I'll be right there next to you, Ryan, hoping that we can make some of this come to fruition here as soon as we can.
There's a question that just came into the chat, and I really encourage folks to drop more questions in the chat or through the Q&A function. But Francis asked a good follow-up to this. Aren't a lot of those challenges linking data due to privacy requirements? And the answer is sort of, right? I mean, the big missing link, at least in the US healthcare system, is that HHS's funding is tied to the fact that the federal government cannot create a unique ID, right? And so what you end up having is a lot of different health systems with, Ryan Pinchot typed in one way with, my social security number as hopefully an identifier and things like that. And so the challenges of linking data are the fact that we don't make it easy to do so. And actually what ends up happening today, which is kind of crazy, is because we don't have one number to link data, not from like what we do here at Prealize, but at least the system broadly between health systems. When they share data, they actually share a lot of information about you, right? When they share me, they share my name, my address, like everything, hoping that, you can match who I am on the other side. And so weirdly, in the pursuit of privacy, of creating this one number that can make things a lot easier, we actually share far too much about people when linking information. Thankfully, on the claim side and the health plan world, you all and we all have created just a member ID. Like that's such a powerful mechanism to create linking. And so we do it, it's a lot easier for us to do. I think the linking challenges you hear on the clinical side are far different because they don't have that one little asset to tie everything together. And I think ultimately privacy and working on the behalf of the consumer and patient is the most important principle. I think in all of the actions that you do and can do with someone's data, it really has to be on behalf of them. And I think that's like a core principle here at Prealize. It's that every and any recommendation that we make is really about taking care of your member better, right? It's like one of these things where the member knows you're going out of your way and going above and beyond to think about them. And so it's an important question, Francis.
Something that you just said, Ryan, in this topic of interoperability, as I speak to and interact with a lot of entrepreneurs who are excited about interoperability and the FHIR standard and kind of what and how are they going to participate. I've seen a skew toward thinking about the connectivity just to EHRs and kind of the API connectivity to EHRs. And I remind people and try to this point right now, which is one is connecting to the clinical data and the payer data. And if I could kind of implore more payers out there to kind of take a page out of Premera's book, so to speak, in, John, to just, again, kind of congratulate you and the Premera team a little bit on how willing you are and have been over many years in my experience to engage with early stage companies innovating and to kind of help along the way, because I think payers are just daunting and overwhelming to entrepreneurs and to small, nimble companies. The idea is, one, I can't possibly navigate or find someone who can help me make sense of how a payer works. And the minute I do, it's going to be like walking through quicksand, and I need to innovate and move quickly. And I think there's a meeting in the middle there, which is we can drive much more consumer grade, actionable technology and innovation through that partnership. And so that's, some of what comes to mind for me is that separate from just kind of using the great API layers and providers out there who are creating the ability to innovate on top of the EHRs, to also kind of innovate on payer data, because without connecting payer and provider data, we won't solve some of these problems.
Super. There's a question from the audience from Andrew Riley. Technology and data analytics are a great tool, but how can we turn that data into actual actionable events that will create the changes within the member population? I'll throw that one to John Cake first.
Well, I can get started with that. Yeah, right. That's obviously getting to action and things. And I think for us, we've used technology and analytics to hopefully put a little bit more finer point, or take a less of a spray and pray approach to certain outreach opportunities and things that we do. We sort of feel like the more that we know about the member, the more relevant we can be in how we engage with them, and hopefully create meaningful things and for them to do and consider. And so I look at opportunities like where, using technology and data analytics to see members who haven't been filling their prescriptions, members who potentially haven't had preventative visits, have care gaps or other kind of quality things that typically would be taken care of that the data shows us we didn't get closed for whatever reason. We're using that on the care management side, even we're trying to be more proactive, but even just looking and seeing in the data where people are accessing care and rounding back on things like that. And so those kind of points of learning and understanding our members in a new and different way, I think present the opportunity for us to be more proactive in outreach, and doing it, of course, in a way that is not creepy and not but in a thoughtful and proactive approach, in a way that helps solve problems for members. And so we all probably have teams and teams of care managers that are doing proactive outreach by phone. If we have a better idea of what our folks are dealing with in the present, and coupled with what they might be dealing with in the future, that starts to change the conversation in a way of like, hey, I know you just were discharged from the hospital. Let's make sure that we're coordinating your care so you don't get readmitted. But also, there may be 3 or 4 more things that you're going to be dealing with in the future that we want to make sure that you're taking care of, and that you have confidence that you're going to have the choices and things to make to treat those conditions. And so for us, it really is about looking for those opportunities, technology-driven, data-driven, that allow us to be a little bit more proactive and relevant to our members. Obviously, we still have challenges in the health plan space of being able to connect with our members in really efficient ways. I wish we had more mobile phone numbers and more email addresses and things like that, but that's that's going to get solved, and we're solving that, and people are comfortable with exchanging information in those areas. And so I see some of those barriers kind of coming down pretty quickly, hopefully.
Andrew, one thought to throw on there too as well is you're right, technology and data analytics are a great tool, right? But dashboards aren't enough, and I think that's, at least for us as investors, and the reason why we spend so much time with Prealize is that the recommendations are individual members, right? It tells you which members and the drivers for why, and that's a really powerful thing. So it's not even just insights, it's really actionable things that you and your health plan can do. And so that link from, hey, these are generic macro level things of the past, right, are actually now individualized recommendations for individual members and the why that's there, right? Because I think one thing that the team takes a lot of pride in is that it's not a black box, that where you throw a bunch of things in and hope things come out. It's actually one where it's the box is sort of sharing and telling you why sets of members need intervention. And a lot of times when you look at it, you're like, oh, this seems like, oh yeah, that's right, this makes sense. They haven't come in for these things, but there's no humanly way possible for all of us on this call to do it for thousands and thousands of members. So the system really helps with things like that.
Mm-hmm. Yep. In a perfect world, healthcare leaders would have unlimited resources, right? And we all hear about capacity constraints. Obviously, technology and things like that can help with this, but how can engagement leaders really think about more efficiently harnessing their resources?
Well, I can tell you the opposite way of harnessing resources. I'm teasing, Linda. I worked in government for almost 4 years, and so we tried to change things there, right? Usually, procurement cycles in government, take this 3 to 4 year long period of time to make things happen. Healthcare.gov is a great example of that. Affordable Care Act gets signed, a contract goes out, and then 3 years later, magically build a website that does this thing. And, if we could do that again, or do a lot of these things again, you should really start small, like immediately day one after, the legislation was passed. Within a month or two, what should have been done was, how do you start to create the basics of what that healthcare.gov looked like? But let me translate it into a takeaway for the team and folks here, which is start small. How do you pilot? How do you try things out before you commit to these long 2-3 year long cycles, when at the end of it, you find out, wait, I've got this healthcare debacle on my hands. In the case here, it's really about defining what success looks like. What does a prototype look like that shows, yeah, this is worth scaling to my broader patient population? And so to think about taking a lot of risks like that, because if you start and do 5 or 10 pilots, right, of things, it's really easy to cut things when they're not working, right? Versus putting all your eggs behind one basket and hoping it works out at the end. And so that's one of those things we tried to introduce in the government, but it really applies everywhere. Taking more risks in smaller ways with really structured ways of defining what success looks like, because then you can make a great case for scaling it throughout your company.
Others have, go ahead.
I was
John.
just going to say, I think on the provider or on the payer side, resources are limited, but I know, across the board, I think payers are really taking and being thoughtful and investing in their member experiences across the board. And so, but while those initiatives are underway, you're right. We don't have unlimited funds, and so it's paramount to use those funds as wisely as possible and kind of target as much as possible. We've seen, looking at opportunities and have seen opportunities where information that we get from Prealize sort of changing the paradigm from how we've historically used data, looking back at utilization patterns to kind of identify and target for our initiatives, changing the view to being more forward-looking. And so a great example, we've rolled out centers of excellence for certain types of care. And historically, we would target members by looking back, and those who have, if it's a knee replacement, those who maybe have had a visit with an orthopedist, it's probably too late then. And then, to get that postcard in the mail that says, hey, we have this great center of excellence. And so, being able to, and that maybe is a waste of those valuable resources there. And so thinking about ways for us to kind of change the paradigm and being more proactive and forward looking. Another thing that we've done in some of the tests with you all that has been interesting is, taking our current targeted lists and comparing them to what a similar list being generated using a different approach to targeting using predictive analytics, machine learning. There's a little bit of overlap, but there's some distinct differences in those lists, which tells us, there may be something else to look at here that we've been missing all along. And so thinking about really getting the most bang for your buck out of those dollars, and like Ryan said, and just getting started and getting in there and learning and getting things through the platform and adjusting and being willing to get going is the best one.
Yeah, I would say, the silver lining of having limited resources is that it has to force prioritization. And when I think resources, not just dollars, but the time of your talent. I'm guessing that all of us on this call have been in some conference room in a healthcare setting with many people trying to solve a problem and spending hours and hours designing the system from end to beginning. And I think sometimes in healthcare, we think we need to rebuild something because if it's not working, it's because nobody has figured out how to make it work. And so let's us figure out how to make all of it work. And I think this comes to let's figure out what piece we each need to do and play, and how can we stitch together the best experience for our members and with the best result for our members and the plan, and be open that the answer is going to involve other people, other parties, other partners, taking what sometimes may feel like a part of what we think of as our core competency. And so in the case of Prealize, for instance, it's not that health plans don't have great data and wonderful, talented people who can analyze that data, but it's unlikely that the plan has the resources to have the level of talent and expertise in artificial intelligence and machine learning and the tools and the dedication 24 hours a day, 7 days a week to do what Prealize can do with it. And so I think kind of taking, hearing what John has talked about and how Prealize has helped Premera in this way. Again, it's not that John has said, well, wow, we don't have good data analytics. And so I think it's being open to partnering and finding places where you can really bring the best of something to help you, the plan, or you, the provider, be the best overall. So I think the answer is, yeah, we don't have limited resources. You should protect your resources ruthlessly, your time and your dollars, and let's let people do what they're really good at and be a team.
Yeah, I guess I would add to that, looking at your neighbors, looking at your peers, looking at your colleagues can give you ideas, looking at what's best of breed in the industry, but also looking outside of healthcare, right? Many of these, like you mentioned earlier, Kristen, the consumer engagement experience is so different in retail and banking. And what are the best practices from those industries that healthcare should really rapidly adopt? And like Ryan said, pilot here, test it here, really think about the member journey that can change their behavior. I see we're at time, and so I'd like to thank everybody for listening, for submitting questions if you did, and thank you to the panelists for participating as well. Really, thank you for joining, and we look forward to seeing you at future events.
Thank you.
Thanks, everyone.
Thank you.
Bye.